Levels of consciousness. This is where you talk about if the person is oriented, 1 time, 2 times, 3 times, 4 times. They know who they are, where they are, time, place, event, things of that nature when it comes to levels of consciousness. So the orientation is what gives you insight about the patient's cognitive functioning. A normal finding is for the patient to be oriented times 4. That means they know who they are. They're able to tell you their name, the place. They know where they are. They know if they're in the hospital or if they're in a medical facility or where they are. They know the place as well as the time and the situation. The situation could be, who's the president or what brought you to the hospital today. Just, this is to help you to understand if they're cognizant in that moment or at that time. For time, the patient can identify the day, the month, the year, or even the season. Those are things that will let you know that their level of consciousness is on point at that time. Also, the Glasgow Coma Scale. So for anybody who is a nursing student, planning on doing nursing, or even just interested in medical school or anything in general, the Glasgow Coma Scale is very important because it's usually the scale that's used to assess the extent of a patient's consciousness based on a few categories. So the 3 subcategories that it's based on would be used for patients who have sustained head trauma. About the coma scale, so they're all rated based off of a person's head trauma. So they would get 4 points for opening their eyes spontaneously. Like if you were to enter the room and the patient opened their eyes, that would be 4 points to let you know they didn't need help opening their eyes. It would be 3 points if you had to actually call their name and they opened their eyes in response to your voice. Then it would be 2 points in response to pain. 1, no eye opening at all, right? So then there's also the subcategory of verbal responses, whether they are coherent and oriented or incoherent, disoriented. If they're making inappropriate sounds or if the sounds, it's just sounds with no words. Those are things that would be on the coma scale to let you know their level of consciousness. And their level of consciousness is based on a max of 15. So 15 points is max. That's the normal score, but a minimum score of 3. So anything between 13 to 15 means that they have mild head injury. And then 9 to 12 is moderate head injury. Anything less than 8 means severe.